Medical care provision, analyzing the stages of nursing process. The nursing process is essential in providing proper medical care to patients. It is a process of planning and providing the right medical care to patients used by nurses, which is based on principles that include observation, diagnosis, planning, implementation, and evaluation. Thus, the nursing process is an integral part of good medical practice. This paper will evaluate and explain in detail each step of the nursing process, which is essential in providing the proper medical care to patients. The first step of the nursing process is observation. Nurses need to closely observe patients, assessing their physical condition and analyzing their medical history. They need to scrutinize the patient's behavior, with every minor detail being recorded. Through these assessments, the nurse will be able to identify any potential health problems or risks that the client may have. This step is necessary to provide the best care to the patient. The second step that is essential in the nursing process is diagnosis. Nurses need to use the symptoms they observe in the patient's medical history to make the right decision about how to help the patient best. They can also use tests and other diagnostic tests to make the right decision. During this step, the nurse will also assess the patient's progress and evaluate any changes to their health. The third step of the nursing process is planning. This step involves making decisions about what measures to take to help the patient best. In this step, nurses need to determine what actions need to be taken and which medications need to be used. This plan of care will include specific goals and objectives that will help the patient reach their desired outcomes. The nurse will also determine the interventions that will be used to help the patient reach their goals and objectives. The fourth step of the nursing process is implementation. At this step, nurses need to provide the patient with the treatment or procedure they have developed. To do this, they need to use the skills and knowledge they have acquired during their training to provide the best help to patients. This step is the most important, as it is here that the nurse will be able to impact the patient's care directly. The nurse must ensure that the interventions are being carried out correctly and on time. Finally, the nursing process ends with the last step, evaluation. Evaluation involves tracking the results of the patient's treatment and creating a plan that will help them next time. At this step, nurses need to analyze the help they have provided and the results achieved to make the right decision in case of future problems. This is a crucial stage in the nursing process, as it ensures that the patient receives the best care possible. The nursing process is a complex of activities carried out by a nurse to ensure quality and safe medical care for the patient. It is a simple and practical method of providing the proper medical care to patients, which is based on the principles of observation, diagnosis, planning, implementation, and evaluation. Every stage of the nursing process is important because it helps the nurse to properly assess the patient's health and provide the correct treatment.